Hi, my name is Sarah, and today we will be reviewing the Innominate or Coxal bones for Bio 231 lab. On the screen is an anterior view of the pelvis, and the two coxal bones are highlighted. There are three separate sections of the coxal bone: the ilium, the ischium, and the pubis. Now, the coxal bones connect on the anterior side of the body, anterior meaning the forward part, and posterior meaning the back. And where they connect, there is a piece of cartilage called the pubic symphysis. And when they do connect, they make an arch known as the pubic arch. This is a lateral view of the right coxal bone. And on this top portion of the surface, there is a small region known as the ala of ilium. And on the posterior side, there are two protrusions, and they are known as the posterior superior iliac spine and the posterior inferior iliac spine. Now, below the ala of ilium, there's a surface known as the body of ilium. And then below that, there's a hollowed out portion, and it kind of looks like somebody took an ice cream scooper and scooped out bone. And that is known as the acetabulum. And the acetabulum will be the socket portion of your ball and socket joint. So the head of femur will be going inside the acetabulum, and that will form the hip joint. This is a medial view of the right coxal bones. And this top ridge is known as the iliac crest. And like the posterior side, on the anterior side of the coxal bone, there are two protrusions known as the anterior superior iliac spine and the anterior inferior iliac spine. And one way to know whether or not you are looking at the anterior or posterior side of the bone is looking for the greater sciatic notch and the lesser sciatic notch, because those two will be on the posterior side of the coxal bone. Now, next to the lesser sciatic notch is kind of a hole or a missing piece, and that is the obturator foramen. And an odd way of remembering what that is called is if you were to hold a coxal bone up to your head and speak into the microphone, you'd be speaking to the obturator foramen. And instead of asking the operator to talk to your foreman, you just say obturator foramen. On the superior side of the coxal bone is the auricular surface, which is a connective ridge, and that connects to another bone. And this is an anterior view of the right coxal bone. And a large portion of this surface is known as the iliac fossa. And as you may remember from week 1, the iliac fossa, it means shallow depression or hollowing, which is exactly what this is right here. And then we're going to look at the pubis. So the pubis has two branches. One is the superior ramus of pubis, and the other is the inferior ramus of pubis. And in the middle, you have the body of pubis. Now, with the inferior ramus of pubis, notice that it stops about halfway down that branch, and that's because the other half of that branch is part of the ischium, not the pubis. This is a posterior view of the right coxal bone, and this part right down here is known as the body of ischium because it is a part of the ischium. And then that gives way to the ischial tuberosity. And remember that tuberosity means a rounded prominence. And this one in particular may have some texture to it. Above that is a protrusion known as the ischial spine. And that's all you need to know for Bio 231 lab about the coxal bone or the innominate bone. And thank you so much for listening. If you have any questions, please speak to your professor and your TAs because they are there to help you and they want to see you succeed. Thank you.